So the first question is, in your opinion, what is the best diet to use when trying to lose weight? That's a good question. There is no one single diet that's going to be best for losing weight. The general equation for losing weight is calories in and calories out. So if you have less calories out, or if you're exercising more than you're eating, then you are going to be theoretically losing weight. Hormones can get involved, things can get complicated. So with that in mind, if I had to recommend 3 diets, the first one I would recommend is a Mediterranean diet, which is high in plants, but mostly high in nuts, seeds, healthy oils like olive oil and fish. So one of the things about consuming oils that's really good for people is it actually increases your satiety. So besides healthy oils being healthy for you, it also increases your fullness. And so that's a pretty good reason why the Mediterranean diet can help you eat less, because if you're eating those healthy fats, it's going to fill you up faster and then you're not going to be as hungry. Fats are high in calories though, so that can be a problem if you're eating too many of them. But if we compare fat to sugar in terms of fullness, fat's going to make you feel a lot fuller than sugar is. So even though sugar is lower in calories, it's not going to fill you up. And so then you're going to need to, keep eating. You're going to get hungrier more often. So having some healthy fats in that diet is going to make you feel fuller. Just beware of the added calories. So I like the Mediterranean diet for that. On top of that, we have fiber in a plant-based diet. So just any plant-based diet, eating lots of things with high fiber is going to give you some good, I guess I should say the fiber is kind of like fat. It fills you up, but it doesn't turn into calories all the time. So you can get some fullness with that. Vegetables still do have sugar, but they're low in sugar. So yeah, Mediterranean diet, plant-based diet, something like that. There is talk about a high-fat diet helping people lose weight, and there is some evidence that it may do that. So one of the things about having a low blood sugar level is that you're actually going to burn your white fat actually burns more calories because it becomes less efficient. So when you have that kind of situation or that kind of scenario set up, it can help you burn more calories overall. Personally, I still am not a huge fan of the high-fat diet. It works for some people. It doesn't work for everybody. So everybody's genetically different. But if I had to give you 3 diets, I would say Mediterranean diet, plant-based diet, and then maybe a high-fat diet if that's something you're into. But I wouldn't go too crazy with that because based on your genetics, if you're eating too much fat, particularly saturated fat, that could be a bad thing. So if you have any additional questions to add to any of this, please let me know in the comments and I'll get around to those. All right, next question. After about 4 hours of not eating, I get instantly so hungry that it causes extreme nausea that it'd almost be impossible to overcome unless I sleep. What is causing this? So I've had this question before in my classes, and I did some research today, and I have a little list over here. Let me switch for you guys. All right, so now this isn't an exhaustive list. This is just the list that I could come up with, and at some point after I go over this, you might just need to go to a doctor because they're going to know more about this than I do. So this is just my initial findings here. When we're thinking about your stomach, you have stomach acid. This is called hydrochloric acid right here. And hydrochloric acid is important because it digests your food, but it can also cause some problems. So around your stomach, you have a little lining that you have, and it's like a mucus lining, and it protects your stomach from the stomach acid because the stomach acid will destroy tissue and that kind of stuff. So one of the things that could happen if you're not eating is you could have a buildup of stomach acid. So if your body is saying that you're hungry, sometimes it can produce that stomach acid to get prepared for actual digestion. And so if you aren't eating and you're building up your hydrochloric acid, and if your issue is associated with heartburn, so heartburn is a sign that your hydrochloric acid is building up. So if you're having heartburn along with this, it could be, that buildup can cause that nausea, right? And so, you could try an antacid if you are getting heartburn with that, and that's kind of when your esophagus starts to burn because you're getting that hydrochloric acid buildup. So that could be one option for you to look into. Another option for you to look into is stomach ulcers. So stomach ulcer is like a sore or a wound inside of your stomach. Again, you have that high acid environment, and if you have some things go wrong, that acid can start to eat away at your stomach lining. So one of the main causes of stomach ulcers is a bacterial infection. If you're struggling with that, you're going to have to go to a doctor. They can give you a test to see if you have it, and then they can treat that bacterial infection. Another cause of stomach ulcers is NSAIDs. So these are painkillers that people often take, aspirin, ibuprofen. These tend to cause quite a few problems. Sometimes as they weaken that mucus lining, I believe, and then that can lead to stomach ulcers as well. So personally, I do not take aspirin or ibuprofen anymore unless I absolutely need to. I definitely overused them when I was an athlete. So it could be a stomach ulcer issue. If I had to guess, I would say that might be something to think about. So once your stomach is empty, you get more acid in there, and then that ulcer really starts to hurt, which then may cause nausea. So I would look into that. Another thing to think about is you have your hunger hormones. So you have ghrelin, which makes you hungry. So when you're not eating, ghrelin starts to build up in your system, and then when it gets high enough, you're going to have to eat at some point. Otherwise, I guess you don't have to, but it's going to make you hungrier and hungrier. And you kind of explain this or describe this in your question. Leptin, again, makes you feel full. So as you're eating, then your leptin hormones start to release. Everybody has different sensitivities to their hormones. And so it could be the case that your ghrelin hormone is building up to the point where it is too high, and then that elevated level is making you feel nauseous because you're just not able to handle that much ghrelin, I guess. And that could make you feel nauseous. Although from what I was reading, that seems to only be slight nausea. So take that with a grain of salt. That same article, which was written by a doctor, was talking about severe nausea. And they were saying that this is probably slight nausea if your hormones are unbalanced or getting confused there. Because if you're not treating your ghrelin hunger hormone with food, then sometimes things can get a little wacky. But they were saying that severe nausea could sometimes be a larger issue. Sometimes this is called metabolic disorder. And so, if some of these other options don't seem right for you, I would recommend going to a doctor. And severe nausea, metabolic disorder screening, go get a screening for metabolic disorder. What metabolic disorder is, it's people who have high blood sugar, high blood pressure, high cholesterol, and then a larger waist size. So it's a combination of things that tend to lead to risk factors, diabetes, heart disease, those kind of things. And sometimes tied with that blood sugar or tied with other things, this can be causing nausea right here. So this could also have some hormone elements as well. And so if this is the case, I would recommend going to a doctor. It depends who you are. If you show these symptoms, it might be a good idea to get tested for metabolic disorder. If you don't show those symptoms, I would try to exercise and then eat a healthy diet, like we kind of talked about in that first question. A diet high in fiber is going to be good for your overall intestines and gut bacteria and everything. So I would try that. Another option that I have here actually is food intolerance. So sometimes people have different intolerances to different types of foods, and if you ate some food and you were fine right away, maybe as you started to digest that food, you maybe started to feel the effects of that food. So this can be a tough one to nail down, because really trying to find out exactly what you're intolerant to is quite a long process. So I would just start paying attention. If there are foods that tend to upset your stomach or something like that, maybe try to avoid those and see if that extreme pain goes away. Aside from these issues here, there were quite a few other options that are more niche, and so most of those require going to a doctor, like gallbladder issues or that kind of stuff. So if it's really bad, I recommend going to a doctor, because they will be able to do more testing and kind of nail down exactly what that is. So good question, though. I've got that lots of times, and everybody's individualistic and there's all kinds of issues, so I'm not quite sure exactly what that one would be. All right, let's go back to this here. And our next question is, I feel like I eat pretty well, but some days I'm not super hungry, so I don't eat a lot. Is this because I ate too much the day before, or because I didn't eat enough? Thanks. So not necessarily. So just because you ate a lot the day before, you're probably going to digest that, so it's probably going to be gone. But there are all kinds of things that affect your hunger. Like your sleep impacts your hunger, so if you didn't sleep enough, that can have an impact. Exercise impacts your hunger, so I find that when I exercise, I naturally get hungry for about I usually eat about 3,000 calories when I'm exercising, and I usually eat about 2,400 when I'm not exercising. So, yeah. Oh, or because I didn't move around enough. Yeah, good. I think it's probably because you didn't move around enough that day. It could be a lot of different factors. Emotions go into that. So if you're feeling stressed, that can sometimes make you feel not very hungry. And on that note, speaking back to this extreme nausea, sometimes stress can actually cause nausea as well. So if you're, really struggling or really stressed out, that could be an impact there. Let me jump over and see if we have any questions here. No, we're still good. All right, cool. All right, next question. Why does diets truly not work for people? So why do some diets truly not work for people, and why is it that our bodies are so individualistic and one doesn't work for everybody? So yeah, that's just down to genetics. A good way to think about this is where your ancestors grew up. So if your ancestors grew up in certain areas that ate lots of dairy, for instance, your body's genetics may be more apt to handle dairy. That doesn't mean that, dairy's fine for you, but depending on where you grew up in the world, what your ancestors grew up eating and what they adapted to eating, that can impact maybe what you can eat. But then there's so much variation in that, and, gut bacteria, it depends what kind of gut bacteria you have potentially, what it can break down. So there's just so many factors that, a well-rounded diet, eating lots of different things is going to be most ideal, particularly a plant-based diet. So that actually leads fairly well into our next question regarding Greek yogurt. So if I have a food that I love, that's very healthy, I eat lots of it every day, is that bad? Do I need to switch up my diet? Good question. So I used to eat tons of fruit before. Like I just eat like a whole watermelon some days. And, my friend was asking me if that was unhealthy. And at the time I was saying that it was healthy. One of the things to think about when you're eating one food a lot is that it's kind of like water. Water's super healthy for you, but if you chug 4 gallons of it, you're not going to be doing very well. Like you can actually overdose on water. So there is such a thing as too much of a good thing, right? Like olive oil is really good for you, really healthy for you. But if you chug a gallon of it, you're going to be gaining lots of weight, which is not going to be healthy for you. So let's look at a Greek yogurt label here. This is just a Chobani label. And most of the stuff in Greek yogurt is going to be healthy for you. So there's a little bit of saturated fat, but I'm not too worried about that. I think for most people, saturated fat is not a super important thing to worry about. I think most people can ingest saturated fat and be just fine. But if we look here, we have sugars. This is the issue with a lot of yogurts, is the sugar amount. So if you're eating plain Greek yogurt, I think you're probably good overall, unless you're one of the people who doesn't handle saturated fat very well. But if you are not eating plain Greek yogurt, you're going to be consuming lots of sugars. And your amount of sugars that you're supposed to be eating per day is less than 50 grams, somewhere between 30 and 50 grams. So if you're eating 2 of these little Chobani things, you're basically at your daily limit of added sugars. Now, this is actually, I should explain, one of these cups of yogurt has 7 grams of natural sugar called lactose because it's a dairy product. And so all those 19 grams aren't added up to your added sugars. And a lot of these have fruit in the bottom, so it's really hard to explain, how much is natural versus how much is added, because they don't have a law that shows that they have to put the added sugars on the label. So, if you're eating like 4 of these a day, your sugar intake is going to be quite high. So what I would do, let's see if we can find, is this a plain one right here? Nope, that's not a plain one. Here we go. Here's plain Greek yogurt, so no flavor. Oh, it's actually peach flavored. 7 grams of sugar. So if I was you, what I would do, and you can see that right here, maybe it's too small, but if I was you, I would look for Greek yogurts that are low in sugar, and then you should be able to eat a substantially large amount. But same with fruit, like my first example, that is lots of sugar in it if you're eating it in mass quantities. So I would just be aware of that, because we don't want to abuse our insulin. We want our insulin to be functioning well. Okay, and then our last question, if I eat whenever I am hungry, but I'm still under my basal metabolic rate, is that bad? Yes, that is not ideal. So a lot of people struggle with this because maybe they haven't been eating enough, and so your stomach actually shrinks to the size that you tend to be eating. This is one of the reasons why gastric bypass works fairly well, because with gastric bypass, what it is it's a surgery that shrinks the size of your stomach. And so if people are really struggling with obesity, they can go in, get the surgery done, and then they're not able to eat very much. And then that does tend to allow them to lose weight. And so sometimes if you don't eat very much, your stomach will get smaller, and then you just get full and you're not eating as much as you need per day. And that happens to a lot of people. This can also happen if you're eating like lots of salads, which salads are good, but you want to add some calorie density to that meal, like nuts, seeds, olive oil, dressings, those kind of things, maybe some chicken, or whatever you need to boost up those calories. Because if you're not eating your basal metabolic rate, your body isn't functioning at its highest level. It's not producing the hormones that it should, not developing the bone density that it needs to. And so we need to be eating our basal metabolic rate just to make sure that our body is, taking care of what it needs to. So unfortunately, the best advice for this is to just try and eat more food. And you're not going to like it right away. It's going to be really hard. But it's kind of just treat it as a thing that you have to do, right? Just eat a little bit here and there, maybe have some snacks, add some high density or some high caloric density foods like almonds or walnuts, maybe fish, right? Olive oil, that kind of stuff. Kind of back to that Mediterranean diet to hopefully boost your basal metabolic rate. Sometimes you got to eat when you're not hungry if you're below that basal metabolic rate or if you're losing weight from that. So good questions. I'm going to open up the chat here and ask any more questions that you have. And if not, here we go. Let me change screens here so I can actually see the questions. All right, so now I can see your questions here. Can you clear up my misconceptions about water intake? Like, is it better to drink a cup every hour or chugging 2 liters in the morning? Okay, good question. So, for most things, taking things not in large quantities is going to be good, or is going to be better, but I don't think it really matters. So if you're really dehydrated, you can chug some water and you can store that up a little bit, but it's probably going to make you urinate more frequently, right? You're probably going to just pee out a lot of that water because you can't absorb it that quickly and you're not using it that quickly. So if you are dehydrated, then drinking a lot of water, if you're severely dehydrated, they actually recommend that you slowly drink water again. Like if we're talking about in a desert dehydrated and they rescue you, they want you to slowly drink water to come back. So, sometimes I chug water. I wouldn't, I haven't really looked into whether you can chug 2 liters of water in the morning or not. You can, but that seems like a lot of water. And I don't see a whole lot of purpose to that. So if it was me, I would just I would just drink water until you're satisfied. And then, if you need more, you can drink more. The best way to tell if you're hydrated is actually a urine test. So you can actually look at the color of your urine. If it's just light yellow or almost clear, then you're good to go. If it's 100% clear, then you're drinking more water than you need. That doesn't mean that's necessarily a bad thing. But you can back off a little bit. And then if it's like darker yellow to brown, then you definitely maybe need to drink a ton of water. So, okay, brown rice giving him constipation. Potentially. Again, everybody's affected differently with foods. Gut bacteria is just crazy. So it could be a lack of water too, because rice absorbs a lot of water. Obviously in the cooking process, but also in your body. Another good tip with drinking water is when you eat a meal, you should actually drink water with that, because you need water to mix everything up and help everything break down maybe not break down, but help everything just be mixed and have a liquid solution in your stomach. So whenever I eat a meal, I always drink some water. So I would try that. And then, he could try removing brown rice and seeing how that affects him. But brown rice is going to have a lot of good fiber in it. So it should technically be good for your gut bacteria. That one's hard to say. I don't know. But good questions. Thanks for asking. Any more questions? I'll give us a couple more minutes here, see if we have anything else.